It is their responsibility not to implement this law. So I urge adoption of the amendment, and I encourage my colleagues to get to work on the principles of health care, which this law absolutely ignores.
Gentleman's time has expired. Gentlelady from Connecticut.
The Rehberg Amendment would increase net budget authority in the bill by $2 billion in fiscal year 2012. That's next year, and a total of $5.5 billion over the next several years. I'd like to yield 3 minutes to the gentleman from New Jersey, Mr. Andrews.
Gentleman from New Jersey is recognized for 3 minutes.
I ask unanimous consent to revise and extend my remarks.
Without objection, so ordered.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. All across the country this morning, millions of Americans got up for another day of searching the job search websites or looking at the want ads, enduring another day of courtesy interviews, pointless discussions with potential employers, and dreading the arrival of the letter carrier today because he's going to bring one more credit card bill or dunning letter for a bill that they can't pay. Life has become a nightmare for 15 million unemployed Americans, and here we are in the House of Representatives. I don't think many of them got up this morning and said, I really hope the Congress, for the second time in a month, debates the repeal of the health care law. I think what our constituents said was, why don't they get to work working together to create jobs in this country? Instead, the Tower of Babel that the House of Representatives has become this week has produced yet another meaningless debate on repeal of the health care law, which followed on the heel of defunding Planned Parenthood last night. Now, it's not bad enough what this bill doesn't do in having us work together to create jobs for the American people. It's bad in what it does do. And it's very important that the members understand the real-world consequences of the chairman's amendment. If his amendment passes, and the parents of a child with juvenile diabetes wake up one day to discover that an insurance company won't sell their son or daughter insurance because they have juvenile diabetes, or will charge them 4 or 5 times the amount of the premium because they have juvenile diabetes, the person at the Department of Health and Human Services who can step in and stop the insurance company from doing that won't be able to, because this amendment says, let's tie the hands of the people here to enforce the law. If an insurance company says to a family grappling with a malignancy or brainstem injury for their son or their daughter, you've run out of coverage, you hit your lifetime limit, too bad, so be it. The person who would be in a position to do something, to require that insurance company to pay those hospital bills, won't be able to do that because this is happening. With all due respect, we've had a debate about using names this morning. I think we're using the wrong name for this amendment. This should be called the Insurance Company Bill of Rights, because what it does is say that anything any insurance company wants to do at any time, so be it. The American people deserve better than this. Members of the House should vote no on the Rehberg Amendment and get back to the business of putting Americans back to work. I yield back.
Gentleman yields back. The gentleman from Montana.
Mr. Chairman, may I inquire as to how much time remains on both sides?
The gentleman from Montana has 6.5 minutes remaining. The gentlewoman from Connecticut has 15.5 minutes remaining.
May I ask the gentlewoman from Connecticut how many speakers she has left?
I'm sorry, I didn't hear the gentleman.
May I ask how many speakers you have remaining?
Several.
Several.
Yes.
Well. Mr. Chairman, I reserve.
More than, I'll take your time,
Mr. Chairman, I reserve the balance of my time.
Gentleman from Montana reserves. The gentlewoman from Connecticut.
The Rehberg Amendment increases net budget authority in the bill by $2 billion in next year, and total of $5.5 billion over 10 years. It increases the deficit, puts the American people back in the hands of the insurance companies. Again, it's a classic bait and switch. I recognize the gentleman from California, Mr. Waxman, for 3 minutes.
Gentleman is recognized for 3 minutes.
I thank the gentlelady for yielding to me to participate in this debate. It's really quite amazing the alternative reality that has been created on the Republican side. They never liked the health care bill. I think people know that already. But it is the law of the land. They try to repeal it. They haven't been able to do it. but the health care bill passed. Under the laws of the United States, people have certain rights under this legislation. For example, insurers cannot drop someone's coverage when they get sick. Seniors are saving money on prescription drugs. Young adults to 26 are getting back on their parents' insurance, and small businesses are receiving billions of dollars in tax credits to provide health care coverage. Well, the Republicans said they like all of that. They like that. When they give us a bill, they're going to have all that in it. But they, meanwhile, want to stop those things from happening under the existing law. Defunding amendments will end these benefits, putting health insurance companies back in charge of Americans' health care. We should realize that when we have a law, it should be implemented in a reasonable, responsive, and efficient manner. States want that, insurers want it, businesses want it, health care providers want it. Trying to starve a program so we cannot implement it in a reasonable manner is irresponsible. Defunding amendments offered in the guise of budget austerity are actually one step toward repealing the largest deficit cutter passed in the last decade, the Affordable Care Act. The Affordable Care Act, if this amendment passes, will be stopped, and there will be no prohibition against discrimination for over 100 million Americans with pre-existing conditions. No prohibition on insurance companies canceling your coverage when you get sick. No prohibition on lifetime caps and annual limits. No required coverage for young adults on their parents' policies. No assistance to seniors struggling to afford the cost of drugs in the donut hole. And no free annual checkups in Medicare. No tax credits for families and small businesses to pay for health insurance. The full impact of this legislation will happen in 2014, and that requires the Department of Health and Human Services to put into place its implementation so that we can move in a clear, reasonable path to accomplishing these goals. Repeal, or even this defunding proposal, is a boon for insurance companies, but an enormous setback for American families. That's why I urge all members to vote no on this amendment. Yield back my time.
Gentleman yields back. Gentleman from Montana.
To my Democratic friends, using the deficit argument is simply a diversion to draw attention away from the real issue, the huge costs of this program. This time I yield 30 seconds to Dr. Burgess of Texas.
Gentleman from Texas is recognized for 30 seconds.
I thank the gentleman for yielding, and seeing Mr. Wack, a gentleman from California down on the floor, reminds me, when this bill passed, the Congressional Budget Office told us $142 billion in savings over 10 years, but less than 30 days later, the chief actuary at CMS, Dr. Foster, came forward and said the bill was going to cost $318 billion additionally over that time. That's a $450 billion swing, and even in the United States Congress, we ought to be able to get it a little closer than that. I filed a resolution of inquiry with Chairman Waxman, who was then Chairman of Energy and Commerce, said, let's sort this out. What did they know? When did they know it? Was Congress given inaccurate information before we voted on this very large bill? I was never allowed to bring that forward. We could have solved that last year and have settled that part of the debate last year. I yield back.
Gentleman yields back. Gentlewoman from Connecticut.
CBO repeal of health care bill would add $230 billion to the deficit in the first 10 years. Rehberg amendment would add $2 billion in 2012, a total of $5.5 billion over the next several years. Let me yield 3 minutes to the gentleman from Maryland, Mr. Van Hollen.
Gentleman from Maryland is recognized. Was it 3 minutes?
Yeah.
Recognized for 3 minutes.
Thank you, Mr. Speaker, and I thank my colleagues. Another day on a bill that will not create one single job in the United States of America. In fact, a bill that will cost thousands of Americans their jobs. The response just the other day from our Republican colleagues, quote, so be it. Now we have an amendment before us to strip away critical patient protections for consumers, for our constituents. This is an insurance industry dream amendment. We heard from our colleagues they wanted to listen to the American people. They have not had one hearing, not one, to listen to the people around this country who are already benefiting from this bill. The provisions to ensure that kids with diabetes, leukemia, asthma are not discriminated against by the insurance industry anymore? Not one mom was heard from. Provisions to make sure that our constituents aren't denied their coverage when they need it the most? There are thousands of Americans out there already benefiting from that. Didn't listen to one of them. And now, under the guise of trying to save the taxpayer money, they're offering an amendment that, according to the independent, nonpartisan Congressional Budget Office, will increase the deficit over the next 10 years by $230 billion. And when it's fully implemented, the bill, and you strip it away, it will add $1.4 trillion to the deficit. Now, I just urge my colleagues to read the letter from January of this year from the head of CBO to the Speaker of the House. It's right in there, plain and simple. Now, we had a hearing in the Budget Committee just the other day. I hope your colleagues on the Budget Committee may have talked to you about it, because the head of CBO was before the committee, and members on the Republican side said, surely you must have arrived at this deficit number through double counting. Head of CBO said very plainly, there's no double counting. Read the lips of CBO. This adds $230 billion to the deficit over 10 years, $1.4 trillion over the next 20 years. So don't come to the floor here and pretend that by enacting this amendment it's part of an effort to save taxpayer dollars. This will add more red ink to this nation's credit card, the same kind of red ink that we saw being added over the years and years and years of the prior administration. We're trying to turn the corner on that, but all this does is add more. And the cost is not just in terms of higher deficits. The costs are to the people throughout this country who are going to lose the important protections that this bill has provided them. Shame on this House for spending time doing this rather than focusing on jobs and getting this economy moving.
Gentleman's time has expired. Gentleman from Montana.
Thank you, Mr. Chairman.
Someplace out west.
Somewhere up north. I continue to reserve.
Gentleman from Montana reserves. The gentlewoman from Connecticut.
Rehberg amendment increases the deficit by $2 billion in 2012, $5.5 billion over the next several years, and does nothing to create a single job. I yield 2 minutes to the gentlewoman from Florida, Ms. Wasserman Schultz.
The gentlewoman from Florida is recognized for 2 minutes.
Thank you, Mr. Chairman. I rise today to oppose the Republicans' latest cynical and callous attempt to derail health care reform, and I think it's quite interesting that the gentleman from Montana would be dismissive of the issue of deficit reduction, and that somehow that's now labeled a distraction. I think that adding $5.5 billion to the deficit when we should be going in the opposite direction is far more than a distraction. It's a moral imperative that we not do that. In the past 6 weeks, we've seen the true face of the Republicans' legislative agenda. Rather than work to create jobs and improve our economy, they've focused on baseless attacks on American families. With their repeal and replace bills, they demonstrated that they don't mind if insurance companies drop patients as soon as they get sick, or that families wouldn't be able to save thousands of dollars by keeping young adult children on their family plan. And with this pernicious amendment, we now see their outrageous attempt to strip funding from the implementation of the health care law. Let's be clear. Our colleagues across the aisle want to yank funding from a law that is already helping millions of Americans. This amendment would seize funding from the agencies and workers who have already been tasked with implementing the most essential tenets of the Affordable Care Act, provisions which are already making a world of difference in millions of lives. If this amendment passes, seniors will be thrown back into the Medicare Part D donut hole coverage gap and be forced to pay exorbitant costs for their prescription drugs. Women in desperate need of an annual mammogram or a colonoscopy will once again face prohibitive copays, or perhaps face denial of coverage for the pre-existing condition of simply having ovaries. And our nation will once again return to the egregious practice of denying so many young children coverage for their health history that they cannot control. Rather than roll back the hard-fought consumer protections and freedoms that unshackled Americans from the whims of private insurance companies, Republicans should be working with us to build on and improve the health care system. Instead, they wish to use this amendment process to reverse the progress that we've made with these vital health care reforms. I'm glad the American people can see their hypocrisy right out in the open. Thank you. I yield back the balance of my time.
Gentleman from Montana.
I continue to reserve, Mr. Chairman.
Gentleman from Montana reserves. Gentlelady from Connecticut. For what purpose is the gentleman from New York rise?
To raise a point of parliamentary inquiry.
What is your parliamentary inquiry?
Mr. Chairman, would it be appropriate under the rules in the UC that have been suggested that we divide the question so that members can vote individually on whether to deny seniors coverage for the donut hole, to deny coverage for pre-existing conditions, to deny small businesses from getting the tax benefit in this bill, all the different things? Would it be appropriate? I haven't finished my parliamentary inquiry. Would it be appropriate to divide the question that way so all of the benefits that Americans get, they can see individually where my Republican friends stand on them?
I thank the gentleman for his inquiry. Under the order of the House of February 17, 2011, even if otherwise divisible, an amendment to this bill is not subject to a demand for a division of the question.
Thank you, Mr. Chairman.
Woman from Connecticut.
The Rehberg amendment would increase the deficit by $2 billion next year, total of $5.5 billion over the next several years, and that is the estimate of the nonpartisan Congressional Budget Office. Increases the deficit and does not create any jobs. And let me yield 1 minute to the gentlewoman from Illinois, Ms. Schakowsky.
The gentlelady from Illinois is recognized for a minute.
Thank you. I would like to say to the Republicans, be careful what you wish for. Your star is fading on this effort to repeal, to defund the Affordable Health Care Act. Only about 18% of Americans now are for full repeal of this bill. And are you the ones that are going to go and tell the American people that insurance companies can drop you when you get sick? Children with pre-existing conditions, well, they can be denied coverage. You go explain that insurance companies can impose devastating annual and lifetime caps, and that pregnant women and breast cancer survivors can be denied coverage, and that being a woman will continue to be a pre-existing condition. That's your mission if you were to succeed. In passing this legislation, the American people finally said, this Congress said, that health care is a right, that it should not impoverish individuals or cause them bankruptcy. Vote no.
Gentleman from Montana.
At this time, I am pleased to yield 2 minutes. 2 minutes to my good friend from Georgia, Mr. Kingston.
Gentleman from Georgia is recognized for 2 minutes.
I thank the gentleman for yielding, and I stand in strong support of the Rehberg amendment. And I do so because this very health care controversial bill, which was passed through strong-arm tactics last year, during a time period when the American public was crying out against it, this was a product of the backroom deal-making in Washington, D.C. This is one reason why the Democrats lost control of the U.S. Congress. It wasn't so much the bill, it was the process. But let's talk about the bill. An individual mandate that's already been ruled unconstitutional by 2 judges, a mandate which the governor of Alaska is saying he's not even going to implement the rule. This is hardly a law that's bringing America together. This bill needs to be put on the back burner and let us retool it and rework it. And I believe that's what the Americans want us to do. It destroys the doctor-patient relationship. One thing that's abundantly clear is people do not want the insurance companies telling the hospitals and the docs how to conduct medicine. But they sure as heck don't want government bureaucrats in Washington, D.C. and all the hundreds of new agencies and the IRS agents coming in and telling the doctor how to conduct medicine. The cost of this, there's not one credible report that says this will bring down costs. And I keep hearing this hollow cry from Democrats, suddenly with 15 million people unemployed, that they are concerned about jobs. I haven't met in the 1st District of Georgia or anywhere else I've traveled in the country, one business person who says this is a great deal. And I want to say this about 26-year-old children. As a father of 4, And I have 3 kids under 26 years old. They're old enough to take care of themselves. They don't need the nanny state coming in. I have raised them to be responsible. At the age of 21, I expect them to go out and get their health care. You know, the average age, I think, in Vietnam was 19 years old. World War II, probably the same. And we have soldiers in harm's way all over the world who can take care of themselves, but we're saying, but come home to Mommy and Daddy. We'll take care of you until you're 26
Gentleman's
years
time
old.
has expired.
15 more seconds.
Gentleman.
I yield the gentleman an additional 15 seconds.
Gentleman is recognized for additional 15 seconds.
And let me say this, Mr. Chairman. If you talk to the nation's governors, Democrat and Republican, one of the biggest drains on their expenses right now on their budget is Medicaid, yet this bill increases the Medicaid rolls 16 million people without funding it. If we want to break our states, we need to keep this bill. If we want to help them, we need to repeal it. Thank you.
Gentleman's time has expired. Gentlewoman from Connecticut.
I remind the gentleman from Georgia that the taxpayers pay for Congress's health insurance as well, and any children that we have are covered under our health insurance. We are in a rarefied air in that regard. We have health insurance, as Mr. Miller pointed out. We go to the head of the line if there's anything wrong with us. That is not the case for millions of people in this nation, and that's what the other side of the aisle would like to continue, that millions of people will not have the same kind of health care that we in the United States Congress have. And with that, let me yield 1 minute to the gentlewoman from California, Ms. Katz.
Gentlelady from California is recognized for a minute.
I strongly oppose this amendment because it is harmful to the American people. It adds significantly to the deficit. And I have listened to my constituents, and they tell me they are opposed to this defunding stunt. Why? If health care reform is defunded, who will ensure that seniors in the donut hole receive half-price medications this year? Who will process the small business tax credits that employers across the country are entitled to this year under the reform law? Who will keep insurance companies honest, protecting Americans from coverage denials and limits on care? The Affordable Care Act is law. It's endorsed by the American Medical Association, and attempts by my colleagues on the other side of the aisle to repeal it have failed. Instead of fighting the same battle over and over again and living in the past, Congress must turn its focus now to what the American people really care about, creating jobs and strengthening our economy. I yield back.
Gentlelady yields back. The gentleman from Montana.
Thank you, Mr. Chairman. At this time, I'm pleased to yield to another physician who clearly understands the cost of health care, Mr. Gingrey of Georgia.
Mr. Gingrey of Georgia is recognized for how many minutes, Mr. Reberg?
Excuse me, 2 minutes.
2 minutes.
Mr. Chairman, I thank the gentleman for yielding, and I stand wholeheartedly in support of his amendment to repeal the funding of Obamacare. Obamacare, and not just my opinion, but and many others have expressed this, is possibly the worst piece of legislation passed in the history of this Congress. In fact, it would probably be better called Patient Pain and Non-Affordable Care Act, because it has accomplished none of the goals that President Obama set out to accomplish, especially not lowering the cost of health insurance. So we in this body, the Republican majority, in our initial week in the 112th Congress, we passed a repeal of Obamacare. Unfortunately, our colleagues in the Senate, the Democratic majority, stopped that. It is our obligation to the American people to defund this wrongful piece of legislation. It is costing jobs all across this country. Talk about things like who's going to solve the problem of the donut hole, as the gentlelady from California just said. Well, I'll tell you who solved it. Big Pharma solved it when the President and the Democratic majority in the last Congress broke their arm and made them agree to cut their prices in half for their brand-name drugs. So there are other ways to solve the donut hole problem than having the federal government take it over lock, stock, and barrel. In regard to having children remain on their health insurance policy of their parents till age 26. Why are they going to have to do that? Because they have no jobs. And why do they not have any jobs? Because of job-killing bills like Obamacare and stimulus and bailout. And I could go on and on and on. We have an obligation to defund this and to replace it with the right kind of legislation that will accomplish the goals of lowering the health costs so that many more Americans can have health insurance and have good health insurance. Mr. Chairman, with that, I yield back.
Ask him about that one. The gentleman yields back. The gentlewoman from Connecticut.
I'd like to inquire about the remaining time, Mr. Chairman.
The gentlewoman from Connecticut has 3.5 minutes remaining. The gentleman from Montana has 1 3/4 minutes remaining.
I yield 1 minute to the gentleman from California, Mr. Garamendi.
The gentleman from California is recognized for a minute.
Mr. Speaker, it's often said that the facts are lost in the fog of war. The facts are lost in the fog of this debate. We should step back for just a few moments and see what this total picture is all about. This is nothing but a class war assault on the working men and women and the poor in this country and literally around the world. Take a look at all of the provisions and add them all up. The decimation of clinics that provide care to the poor and the unemployed. The decimation and the significant reduction of Medicaid, providing care to those who do not have high incomes, including the elderly and the disabled. The decimation now in this of the health care proposals, turning over to the insurance companies once again the opportunity to go after working men and women and deny them the coverage that they need. Taken in total and include the tax provisions for the great wealthy who will ultimately have their tax breaks paid for by the working men and women. Put it all together, and this is class warfare by the Republicans against the working men and women of this nation.
The gentleman's time has expired. The gentleman from Montana.
I reserve my time.
Reserves. The gentlewoman from Connecticut. Gentleman from Connecticut.
Just to say to the gentleman from Montana, I'd like to reserve.
I'm reserving my time to close, so I'm reserving my time to close.
Gentleman from Montana reserved. The gentlewoman from Connecticut.
Can the chairman let me know who has the right to close?
The gentleman from Montana. No. Gentlewoman from Connecticut has the right to close. You.
I have the right to close.
On my amendment? No. I don't.
If you were off the committee, you would.
Okay. So, gentlewoman from Connecticut.
I yield 1 minute to the gentlewoman from Texas, Ms. Jackson Lee.
Gentlewoman from Texas is recognized for a minute.
I thank the gentlelady. 800 seniors gathered just a year or two ago expressing their horrific opposition to the idea of being overwhelmed by this donut hole. My colleagues today are telling seniors all over America, we now will close the door on you again. We will ensure that you will not have the money to pay for your rent or food because you will be paying these ridiculously high costs for your prescription drugs. That's what this amendment will do. It will close down, potentially, the Affordable Care Act that is providing a lifeline for our seniors. And then if you're laying on the sick bed in your hospital room and you need more care and more care to restore yourself, you have a doctor or an administrator come in and say, your insurance company called and they're pulling the plug. Not the plug that the doctors are pulling, but they're pulling the plug. You have no more money. Get out and try to do the best you can. $230 billion this amendment will cost us. But more importantly, this bill is not, the Affordable Care Act, unconstitutional. Only 2 courts have rendered that. And frankly, the Supreme Court will speak. Don't do this to the American people. I yield back.
Gentlelady yields back. Gentleman from Montana.
Thank you, Mr. Chairman. I inquire if the gentlelady from Connecticut is the last speaker, or does she have someone before I go last?
I have just a last speaker.
You have one more?
Yes.
Besides yourself?
There's just one more speaker.
I reserve.
Gentleman from Montana reserves. Gentlewoman from Connecticut.
Let me just explain to my colleague, Mr. Reber. I will take 30 seconds, and then I have one more speaker.
Okay, I reserve. Mr. Chairman, what I'm attempting to do is to be second to the last.
Okay. Thank you. I yield myself 30 seconds. Let me just repeat, be absolutely clear about what this amendment does. It does not create jobs. It adds to the deficit $2 billion next year, $5.5 billion over the next several years, does nothing to bring the deficit down. It increases the deficit, and it puts the American people back in the hands of the insurance companies. Again, and with that, I yield a minute to the...
The gentlelady yields back. Gentlelady reserves.
Reserve.
Gentlelady reserves. I think you're second to the last. The gentleman from Montana.
Thank you, Mr. Chairman. You know, I'm not the Speaker of the House, I'm not the Majority Leader, but you know what I do? I represent more people in the United States Congress than anybody sitting in this body consistently. After every census, I have the most population. I probably have more town hall meetings as well. I probably have more hospitals, more highways, more of everything in my congressional district. And I've had more town hall meetings probably than anyone, 75. And in those 75, they all tell me the same thing. They do need health care reform. They need to control the cost of health care, but they get it. They understand. This does not do it. You would not need waivers for unions and big businesses if it was working. You would not need legislation to fix the 1099 on the penalty for the $600 purchases if it was working. You wouldn't have to cook the books as they attempt to do by counting a $750 billion tax increase as a reason to suggest that if we repeal it, it's going to cost the government something. That's funny money. It's not true. Nobody in America believes it. Get out, listen at your town hall meetings, travel around my state, do the 75 town hall meetings like I did, and you will find you cannot control the cost of health care if you leave defensive medicine out. We gave an opportunity for people to join the federal system. It was turned down by the Democrats in committee. They voted it down on a party line vote. This is not the way to reform health care. It was done very quickly. In fact, the sponsor of the bill said, I didn't need to read the bill. That's what I have staff for. It was so large, it was done so quickly, there was not enough input that the people of America know this is not the right thing to do. It's a job killer. It's going to bust our budget. In the end, it does, in fact, cost us $2.6 trillion to implement in the first 10 years. Please support this. Let's begin defunding Obamacare.
Gentleman yields back. Gentleman's time has expired. The gentlewoman from Connecticut.
I yield the remainder of our time to the Democratic Leader of the House. 1 minute.
Gentlewoman from California is recognized for a minute.
Thank you, Mr. Chairman. I thank the gentlelady for yielding. I commend her for her leadership on a very important issue, the health and well-being of the American people. I rise in opposition to the amendment that is on the floor today and also the underlying bill of which it is a part. The American people are desperate for jobs. They've sent us here to work together to create jobs. And not in the 6th week of this new majority, not one piece of legislation has come forward to create one job. Showing the lack of ideas to do so, the Republican majority has chosen instead to change the subject, to take up a bill of such consequence without hearings, without really an open process, to make amendments to it with the illusion of open debate. And now they come before us, again without hearings, in amendment form to this bill, and say they want to repeal, have no funds go to enact provisions of the health care bill, which was passed before. Let's talk about the consequences of your actions here today. What would it mean to people in our country if this amendment were to prevail? It may prevail on this floor, which is driving itself into irrelevance with the amendment process that is here, but that's another subject. Let's talk about the subject of this amendment. Let's talk about what this means to America's families. Let's talk about a family that came before a hearing that we had earlier in January. We heard from Stacy Ritter. She has 12-year-old twins. When those adorable little girls were 4 years old, they were both diagnosed with cancer. Imagine if that happened in your family. After they faced years of treatment and recovery. Their mother said they were lucky. They did have health insurance, but the additional cost of the care for these children drove their family into bankruptcy. The children got well, thank God, but they had a pre-existing medical condition for the rest of their lives until this bill came along. And now, their mother was pleased to testify they are not to be the objects of discrimination because they have a pre-existing medical condition. They will not face annual or lifetime caps on the benefits they receive. These healthy young girls now will be able to proceed in a healthy way, not discriminated against. Or let's talk about Vernal Branch, a woman diagnosed with breast cancer 15 years ago. Ever since, she has struggled to find health insurance because even though she had cancer and for the moment is free of cancer and, God willing, forever free of cancer, she had a pre-existing medical condition, which meant that she would be discriminated against in terms of getting health insurance until this came along. Vernal Branch told us that the Affordable Care Act represented protection from the uncertainty and fear that came from being diagnosed and being denied health insurance coverage because of a past disease. Passing this amendment would stop the reform and mean that 129 million Americans, like Vernal, 125 million Americans, would lose coverage because of a pre-existing medical condition. Do you understand what that means in the lives of these people? And to our seniors, the subject has been brought up over and over again about our seniors. Claudette Theriault and her husband, Richard, are seniors on Medicare. Richard is a diabetic, and his insulin alone costs nearly $1,000 a month. When they fell into the donut hole, they were forced to choose between defaulting on the loan on their home or paying for Richard's health. As Claudette put it, well, we chose my husband's health. But changes made that we made in this bill are starting to change the donut hole, so families aren't forced to choose between paying their mortgage or paying for their medicine. Passing this amendment would mean that over 2.7 million Medicare beneficiaries would again fall into the donut hole, and Medicare would no longer be able to pay for the annual checkup for 44 million seniors in our country. Mr. Kingston says that his children are old enough and they should be able to take care of themselves even though they're under 26 years old. Bravo for you. But that's not the way it is for many young people across the country, even if they do have a job. You say they don't have insurance because they don't have a job. It may be news to you, but there are many, many, many working Americans who do not have health insurance. But they will under the Affordable Care Act. If this amendment were to pass immediately, if it were to become law, immediately, all of those children who can now be on their parents' policy, if their parents are willing, would lose their health insurance. With a job or without a job, these young people coming out of school are idealistic, ambitious. They want to follow their passions, their pursuits. That's what our founders told them they could do. Life, liberty, pursuit of happiness. These young people want a healthier life to pursue their happiness, to choose a job not based on the health benefits it may or may not provide, but to choose an occupation which addresses their aspirations, not ours, theirs. And so I just want to repeat back to our colleagues something I heard them say over and over again. They said we didn't read the bill. Well, we did. But clearly, you did not. And I urge you to read the bill. Because if you did, you would see that the bill puts medical decisions in the hands of patients and doctors, not your favorite insurance companies. You would see that it brings down the cost of prescription drugs for seniors. You would see that it ends the days of discrimination based on pre-existing condition and lifetime caps on care of children and families. You would see that no longer, under this bill, no longer would being a woman be a pre-existing medical condition as it is now, as women are treated, are discriminated against in terms of price and access to insurance. You would see that it offers tax credits to millions of small businesses who choose to do right by their employees and offer insurance benefits. It was for all of these Americans that we acted. It is for them that we stand here today to oppose this amendment. And if you read the bill, you will see contrary to misrepresentations that were set forth by those who do the bidding of the health insurance industry in our country, you would see what the bill does. You would see that it's about innovation. It's about prevention. It's about care, healthier America, not just health care in America. It's about using the technologies of the future. It's about bringing health care closer to people where they live, to lower the cost, to improve the quality, to expand the access. You would see that it is a bill about the future. Instead of the misrepresentations about this, that, and the other thing, which I don't even want to repeat here, you would see that this is transformative for our country because it gives people the liberty, again, to pursue their lives. And so I'd like to know how many of you read the bill. We read it over and over again to each other, drilling down on different parts of it. So we know of what we speak when we come to this floor. And maybe if you knew more about it, you wouldn't be so quick to say, we do not want to allow children to stay on their parents' policies. We do not want pre-existing conditions we do not want to end discrimination on the basis of pre-existing condition for our children. We do not want to begin to close the donut hole. We do not want to have preventive medicines without cost and copay for our seniors. The list goes on and on. So that's what's happening here today. This is, yet again, another example of our friends standing up for the insurance companies at the expense of the American people, standing up for the insurance company at the expense of the health and well-being of our country. It is, again, an example of Washington, D.C. holding on to the special interest status quo. It is, again, this Congress saying to the American people, we're here for the special interest. We're not here for this people's interest. To Stacy, we're not here for your two daughters. For Bernal, we're not here for women and having them being a woman being a pre-existing condition. To Claudette and Richard, to say to them, too bad about your mortgage. If you can't pay your mortgage because you have to pay your medical bills, so be it. I urge my colleagues to vote against this amendment, which is another manifestation of the so be it attitude of some in Congress at the expense of many in our country. With that, I yield back the balance of my time.
General yields back. Question is on, the question is on the amendment offered by the gentleman from Montana. Those in favor will say aye. Aye. Those opposed, no. No. The opinion of the chair, the noes have it.
Mr. Chairman, I request a recorded vote.
A recorded vote is requested pursuant to Clause 6 of Rule 18. Further proceedings on the amendment offered by the gentleman from Montana will be postponed. Who seeks time?
Mr. Chairman,
For what purpose the gentleman from Iowa rise?
I have an amendment at the desk, number 266.
Clerk will designate the amendment.
Amendment number 266, printed in the Congressional Record, offered by Mr. King of Iowa.
Gentlelady from Connecticut. He reserves a point of order. Pursuant to the order of the House of February 17, 2011, the gentleman from Iowa, Mr. King, and a member opposed will each control 5 minutes. The chair recognizes the gentleman from Iowa.
Thank you, Mr. Chairman. Amendment 266 is the amendment that has had a lot of discussion around this chamber and around this country. And what it does is it recognizes the results of this CRS report, Mr. Chairman. This report dated just last Thursday, February 10, 2011. It took a long time to put all the numbers together in an official document that identified the money that are automatically appropriated in Obamacare. And digging that out, there are dozens of locations that automatically trigger appropriations that go on in perpetuity, and that total in this report is $105.5 billion. And here we are in this CRS, this continuing resolution. The CRS report says $105.5 billion. I'd been working on that for some months, and finally we came with a total. But if we're not able to shut off all of the funding that is automatically appropriated in the Obamacare legislation, both components of it, the reconciliation package and the bill itself, then forever this money goes forward and the administration aggressively uses it to implement Obamacare. So at that point, I would reserve the balance of my time.
Gentleman reserves. Lady.
I claim the time in opposition.
Gentlewoman is recognized for 5 minutes, claiming the time in opposition. Does the gentlewoman continue to reserve your point of order?
Yes, I do. Yes. Let me just very briefly, let me yield myself about 30 seconds.
You're recognized for 30 seconds.
This amendment will add to the deficit in the next year, $3.5 billion, and over the next several years, $5.6 billion. It will not create a job, and once again would put the American people back in the hands of the insurance companies without the ability to be able to get the kind of health insurance that they require to deal with any illness that may befall them. And with that, let me yield to the gentleman from Texas, Mr. Green, 1 minute.
Texas is recognized for 1 minute.
Thank you, Mr. Speaker, members, and thank my colleague from Connecticut for yielding to me. Let me first say that I've read the bill. I was on the subcommittee and the full committee and served on the health subcommittee for many years, and I had many people ask me that. And believe me, when you spend hours and hours literally in testimony and amending the bill, you have the chance to read it. And I would hope my Republican colleagues and all of us would use the same thing, our appropriators. I would hope they would read the appropriations bill if they're accusing us on the Energy and Commerce Committee or whoever draft that bill. What this amendment would do would take away the funding that the Department of Labor and Health and Human Services would be able to enforce that insurance can't drop someone for coverage when they become sick. They would take away that funding. Seniors would be saving money. They couldn't enforce it, saving money for seniors for prescription drugs. Young adults under 26, up to age 26, are getting back insurance for their parents. That would stop the Department of Labor and Health and Human Services from enforcing that law. Small businesses are receiving billions of dollars in tax credits to provide health care coverage. This would stop it. Defunding health care would end these benefits and putting insurance companies back in charge. The whole goal of the health care bill, whether you call it Obamacare, I'm kind of concerned. I wanted it to be called the Gene Green Care Bill. But I admit I'm only one of 435. But that's what this bill is about in this amendment. It will defund the great things that's in the health care law. Let's go back and talk about the things we all agree that need to be changed. But if you take away the money, we'll lose this for all our folks in our districts. And I yield back my time.
Gentleman yields back. The gentleman from Iowa.
Mr. Chairman, I'd be very pleased to yield a minute and a half to the gentlelady from Minnesota, Mrs. Bachmann.
Gentlewoman from Minnesota is recognized for a minute and a half.
Thank you, Mr. Speaker, and I thank Mr. King from Iowa. Make no mistake about it, Mr. Speaker, the effort on the part of Steve King is to defund Obamacare. This chamber already passed a bill to repeal Obamacare, which the American people have asked. This is now an effort to defund Obamacare, because as we have seen from the Congressional Research Service, the ingenious nature of the Obamacare bill was to already put the funding in place so that if the majority lost the gavel, which they did, the new majority would be unable to defund this bill. Speaker Pelosi said it well last year when she said we had to pass the bill to know what's in it. We only found out recently that literally tens of billions of dollars have already been appropriated to fund Obamacare. It was put in, quote, mandatory spending, spending where this chamber would not have access to be able to defund the bill. If we are unable to defund the bill now, make no mistake, Mr. Speaker, this chamber and the American people will do everything they can to make sure they put into place a new president, a new Senate, and a House that will have the requisite courage to finally defund the government takeover of health care. And I yield back to the gentleman from Iowa.
Gentlelady yields back. The gentlewoman from Connecticut.
I yield 2 minutes to the gentlewoman from Wisconsin, Ms. Baldwin.
Gentlewoman from Wisconsin is recognized for 2 minutes.
Thank you, Mr. Chairman. I rise in opposition to this amendment and in opposition to the underlying bill. I fail to see how Republican efforts to eliminate all funds for health reform will create jobs or help our fragile economy recover. Instead, defunding health reform would leave behind thousands of whom I represent in Wisconsin, thousands of Wisconsin families who have already begun to experience the benefits of health care reform. Should the Republican efforts succeed, tens of thousands of young adults in Wisconsin would stand to lose their insurance coverage through their parents. Once again, children would be refused insurance, discriminated against because of pre-existing conditions, and nearly 50,000 Wisconsin seniors would face higher prescription drug costs. What's more, the efforts to defund the health care reform law come on top of extreme cuts to community health care centers and family planning clinics. While I agree with my Republican colleagues that we must reduce the deficit and bring the budget into balance, we must be smart about it, and this amendment is not smart about it. This unwise bill jeopardizes our nation's health, our nation's recovery, and our nation's future, and is particularly troublesome to me this week because it falls on top of efforts by Wisconsin's governor to cut health, education, and public safety services and to take away the rights of public servants to provide them. Mr. Chairman, today I stand in solidarity with my fellow Wisconsinites as I fight for a better future for all Wisconsinites and all Americans. I urge my colleagues to oppose Republican efforts to defund the health care reform law and to oppose the underlying bill.
Gentleman yields back. The gentleman from Iowa.
Mr. Chairman, I would be pleased to yield a minute to the gentleman from Georgia, Mr. Gingrey.
Gentleman from Georgia is recognized for a minute.
Mr. Chairman, thank you, and I thank the gentleman for yielding. I stand in full support of the King Amendment. I was at the well just a few minutes ago in support of the Rehberg Amendment. But what this amendment does is stop the funding, the $100 billion worth of funding that was automatically put in this bill to prevent, if we took over the majority of this House, Mr. Chairman, as we have done, try to stop us from stopping the worst bill that's ever been passed in the history of the Congress. And we have to do this. This is a pledge to the American people. We can do it. We can start over. We can make this bill right. we can enact health care reform that truly does bring down the cost for patients so they can get access, they have more control, and that we don't destroy the medical profession in the process of continuing this wrong-headed, boneheaded Obamacare bill. So I want to stand strongly with my colleague from Iowa in supporting this amendment, and I yield back the balance of my time.
Gentleman yields back. Gentlewoman from Connecticut.
I yield 1 minute to the gentleman from Oregon, Mr. Blumenauer.
Gentleman from Oregon is recognized for 1 minute.
I appreciate that. My friends on the other side of the aisle talk about listening to the American public. Well, I've been back home in my district meeting with providers, people in the insurance industry, hospitals, nurses, and they are dealing with this plan moving forward. They're excited about the opportunities to take advantage of it. The protections that are underway in the law right now are popular with the public because they're important to the public. My friends talk about listening to the American citizens. The Associated Press pointed out in a poll last month that the overwhelming majority opposed the notion of trying to defund health care, and in fact, in that same poll, 43% thought the protection should be expanded. We are in a situation now where we can make a profound difference in improving the quality of health care in this country while we reduce deficits, putting sand in the gears, arguing, trying to create confusion is not moving us forward. Work with our hospitals, work with our doctors, work with our citizens, make this work for America.
Gentleman from Iowa.
Mr. Chairman, how much time does each side have remaining, please?
Gentleman from Iowa has 1 1/4 minutes remaining, and the gentlewoman from Connecticut has 30 seconds remaining.
In that case, then I would reserve to close.
Gentleman reserves. Gentlewoman from Connecticut.
Do I have the right to close, Mr. Chairman?
Yes. The gentlewoman from Connecticut has the right to close in opposition to the amendment.
Thank you, Mr. Chairman.
Wait, does the gentlewoman from Connecticut, are you reserving?
Yes, I'm reserving.
All right. Gentleman from Iowa.
Thank you, Mr. Chairman. This amendment, Amendment number 266, someone put the moniker on it, the Silver Bullet Amendment. And as much as we have all worked here to try to find the right way to shut off all of the funding, to freeze in place the implementation and enforcement of Obamacare, many of us have worked in a number of different ways. This is the one that the amendment that goes back and looks at the pattern that was set, that I understood back in 1974 when there was a CR before the House of Representatives that shut off all funding that would go to the Vietnam War for offensive or defensive operations in the air over, the land of, the seas adjacent to, or the countries adjacent to it. That language covered everything, and it stopped bullets on the dock from going into the hands of people to defend themselves. I disagree with the policy, but the foundation is here in multiple places in the history of this Congress. This is the language that shuts off the funding of Obamacare until such time as H.R. 2 becomes law. That's the repeal legislation that becomes law. This is H.R. 1. It's completely appropriate that H.R. 2 and H.R. 1 are married together, and that we shut off the funding for the implementation of Obamacare, all of it, the entire $105.5 billion that were slipped into this report that we just got back last February 10th. So, Mr. Chairman, I urge the adoption of this amendment, and I would yield back the balance of my time.
The gentleman's time has expired. His time has expired. He yields back his time. The gentlewoman from Connecticut.
I urge my colleagues to oppose this amendment. What we need to be doing is to focus on jobs, to grow the economy, and to reduce the deficit. This amendment does none of the above. Essentially what it does, it takes us back into the hands of insurance companies when they had free rein to raise rates, to no recourse. It protects their CEO bonuses and their corporate profits. We need to be about the business of creating jobs. This amendment does nothing to do that and increases the deficit. It should be absolutely clear to everyone here and everywhere else what this amendment does. Mr. Chairman, I make a point of order against the amendment because it proposes to change existing law, constitutes legislation on an appropriation bill and therefore violates Clause 2 of Rule 21. And the rule states in pertinent part, and I quote, "An amendment to the general appropriation bill should not be in order if changing existing law." Waives existing law, and I ask for a ruling from the chair.
The gentlewoman from Connecticut has stated a point of order against the amendment. Is there anyone who wishes to be heard on the point of order? The gentleman from Iowa.
Thank you, Mr. Chairman.